Hello and welcome back to a brand new episode of More Than a Business Live. I am your host, Mitch Case. I am also the co-founder of More Than a Meal, where we help you show gratitude, appreciation, and empathy to your employees, to your clients, to the community, one meal at a time. We're in season 2 of More Than a Business Live. I couldn't be more grateful for the time that I've had with the amazing guests in the previous season and the many more guests that we've got coming on this season. We do have a brand new sponsor, Clarity Direct Partners. They are a local staffing company that really works on finding trustworthy and reliable folks and put them to work with good organizations. So we're grateful for the sponsorship from them. The reason I started this show a little over a year ago was the intent to really find leaders within organizations and the organizations themselves that really put their people before profit, before revenue. And I've just seen year after year of having conversations with these individuals, there's a lot that goes into actually making that happen versus just wanting it to happen. So I'm incredibly grateful for our guest today. We're going to bring him on here in just a second. But before we go and do that, go ahead and if you are tuning in on LinkedIn, Facebook, YouTube, wherever you're coming from, go ahead and shoot something into the comments as we have conversation today around our guest. We want to make sure that we can try and answer those questions as soon as possible towards the end of the show, most likely. So without further ado, I am going to welcome Jeron Ravin to the show. Jeron, welcome to the show, man. How is it going?
It is going.
It is. I know we talked before the show. We're hitting that afternoon slump right now. So we're going to power through. I'm going to try and bring that energy as best as we can. But Jeron, go ahead and let us know a little bit about who you are, what you do over, and I didn't even tell anybody who you're with Swope Health. So go ahead and tell us a little bit more about your day-to-day and what that looks like, and then we'll jump right into our first topic.
Yeah, Mitch, thank you for the ability, the opportunity to do this. I'll tell you that I'm the president and CEO of Swope Health. Swope Health is a 56-year-old community health center, and we provide care to individuals who are oftentimes cannot access healthcare in the kind of traditional, commercialized, profit-driven healthcare system. We like to think of ourselves as the antithesis of that, and really folks that are focused on providing care at a high level in an inexpensive way as possible. My day-to-day, it varies every day. Every day is something new. That's why I love this job. It's a new challenge every day. Today I have the opportunity to be with you, which I love, and I want to thank you for this idea, giving nonprofits and folks who are putting people in front of profits the ability to showcase what they do, because we don't always get that opportunity. But tomorrow I'll be working on city council stuff, trying to make sure that we get the funding that we need to provide care to folks who need it. Next week is a board meeting. We have those every month. And then there's always something new in the work that we do. So I am lucky that this job is dynamic.
Yeah. Well, I know I speak for many others too. Just grateful for the care that you provide for our city, for those in need as well. So what I'd like to start our show off every single time is just this impact story. And the goal behind this is to really kind of hit on the work that you guys are doing and how that truly does positively impact a team member, a community member, maybe even a patient. So if you've got like a positive impact story in mind, we'd love to hear a little bit about that.
Yeah, I'll tell you, I have countless, and I know we only have a little bit of time.
I figured that'd be the case.
Yeah, but I love the ability to share these stories. So I'll start with something that really warmed my heart, and I spoke a little bit about last night at an event. We have a gentleman here at the organization who's celebrating 25 years of sobriety this month. Had some challenges with substance abuse early on in his life, and what I love about Mr. Clark's story, his journey, is he is now a core part of our substance abuse program. He's helping everyday people in their lives get through that journey the way that he did, and that lived experience is so critical, so vital to being able to help people on the other side of that challenge. And so, earlier this year we responded to the Chiefs parade, mass shooting event, and did some counseling and therapy and crisis intervention for the businesses and attendees weeks and months after. I'm thankful that our team jumped in at first. I mean, healthcare professionals are not always viewed the same way maybe that our first responders are, but we often run to the danger. We're running to save people. We're running to the ability to give people another opportunity and a shot at health and wellness. And I love that we have the opportunity to do that for Kansas City. So those are just a few examples, and there are so many more of the 700 employees that work for this organization that are doing good work.
I mean, this might be a little bit selfish on this end, but obviously, with our company being really focused on the empathy side of things, and you talked about Mr. Clark and having lived experience, has the ability to empathize in a way with these individuals that you guys encounter in a way that maybe a lot of us would never be able to put ourselves specifically in their exact shoes. How do you how do you teach empathy within your organization from I know that you have that at your heart, but sometimes it's not as easy to see it all the way down to your frontline workers here. So what are some ideas? What are some things that you've kind of recognized through your leadership journey here that really kind of helps explore and show empathy for those types of patients?
Yeah, I mean, that's such a good question. Here's what's wonderful about many people who are in healthcare, particularly nonprofit safety net healthcare. They're empathetic already, right? Their core basis is to care for people. They're caregivers by nature, and so
Yeah.
what we try to do is be trauma informed in a way that we recognize that can be exhausting, right? I mean, you think about it as a healthcare professional, you're oftentimes encountering people who are not having a good day, that are not feeling well, that have sometimes they hear difficult news, right? And so
Yeah.
what we try to do as best we can is celebrate our healthcare professionals every day, tell them that they're doing a good job, tell them that we appreciate the work, give them the impact stories that you asked about today to let them know that their work is meaningful, right?
Yeah.
Those things matter. But the core kind of challenges of caring for people who are not well is difficult in itself. And the best you can do is be consistent in letting people know that they matter and that they're making a difference.
I can't tell you how much I appreciate you even just saying that. I don't know if you were aware, but my wife is a nurse right now, and even for herself, walking into work when she does, she'll say a quick prayer just to make sure that God can make her remember she is dealing with a human being and not just a patient.
Mm.
To bring out that empathy. And, as far as you say, like they have a baseline of empathy, that definitely checks the box. My wife is definitely an empath at heart. And it does, it makes her good at what she does so that she can bring that into her work, which has been very impactful across that. So I appreciate you saying that, even as somebody that's not within your system, but just a lover of a healthcare worker here. So thank you for saying that. Jeron, we got to keep this thing moving. We run out of time through here. So as much as I would love to stay on that impact story, let's talk a little bit more about Swope Health. I know there's a lot of different scenarios, and the very obvious thing that makes it more than a business is you're truly making an impact on your patients' lives and getting their health back. But maybe from your mouth, like let us know a little bit more about Swope and what truly makes it more than just a business.
So Swope is a community health center that's been around since 1969. So a long history in Kansas City, particularly Kansas City's east side. We have 23 locations around the Kansas City metro area. So as north and kind of west is Leavenworth, as north is Riverside, Missouri, and south is Belton, and as east is Eastern Jackson County, and really rapidly growing to fill the need of those who need access to care. Swope Health started in a church with 20 employees in 1969 in the basement of Missionary Baptist Church on Linwood. And now today has grown to 700 employees and, like I said, 23 sites, and offer dental care, primary care, significant and substantive behavioral health care, women's health care, uh, medications through pharmacy. We have a homeless clinic and homeless outreach program. We have 3 mobile units serving children, shelters, and a full dental mobile unit. You name it, we do it, for the exception of surgeries. And the outgrowth of this organization is coming from a small church and just a few volunteers is a blessing, and it's a significant story because we understood even then that healthcare is a fundamental right, and there were not enough folks dedicated to providing that care without concern about profit, without being concerned about the patient's ability to pay. And we've carried that forward for the last 56 years. And for me, I've had the privilege of being at the top of this organization for the last 5 years. It is, in my opinion, the most important work I've done in my life, and I'm really thankful on a daily basis for the ability to do that. And I'm constantly inspired by folks like your wife and our associates who are doing the hard work every day. And I can't diagnose anybody. I didn't go to med school. I'm not that smart. But I do cast a vision for this organization that hopefully carries on the work that those 20 folks started some over 50 years ago.
I had no idea you could even legally start a healthcare center within the basement of a church. I mean, talk about like community. And I know you said it's a community health center. That's really, really cool. That's something that I didn't know after being here in Kansas City for now close to 15 years. How are you guys getting the word out to those individuals that maybe don't think that they have that opportunity that you guys are providing? And then I'm going to add a second one to this, which definitely was not on the script today, but like how those that are listening right now and in the future, like how can we as individuals help support Swope as you guys continue to grow your mission and your vision?
Yeah. So I'll start with the last question.
Yeah.
What we're doing right now is a perfect example of that. I mean, I think we're a community-based organization. We are from the community. We hire from the community. We train in the community. We're embedded in the community. We spend a lot of time in the community. We've been doing town halls for the last 2 years on social determinants of health. So talking about the expensive housing crisis in the United States, and particularly in Kansas City, talking about access to healthcare, violence in schools, mass shootings. We have all those conversations, although sometimes difficult conversations,
Sure.
as a way to talk about health and wellness. So we really focus on not only providing care, but thinking about how we're thought leaders in solving some of the serious problems that really prevent people from being healthy. That's the first answer. The second answer is, really we get the word out, or really the work that you're doing right now is super helpful. But if you know anybody that's struggling with access to care for any reason, maybe they don't have insurance, maybe they're underinsured, right? We want them at Swope, and we want them at Swope Health. 40% of our patients are patients who are self-pay, meaning that they don't have insurance at all. And we're going to give them the ability to pay based on whatever they can pay. If you come into Swope Health and say, look, I got $5 today, you're going to be treated as if you have $100,000. We don't care. We don't care. As long as you have the experience that you want and you feel better,
Right. Yeah.
that's all that matters.
I mean, I'm sitting here thinking from an entrepreneurial side of things, and you step out on your own to go build your business. One of the things you tend to lose is some of those types of benefits that you previously had from a comfort perspective within your employer or anything along those lines. And I see it day in and day out just with those that are trying to build something to go out and serve the community, that are trying to do good things. And I can tell you, if having 3 kids and having to pay out of pocket sometimes, that stings a little bit, but knowing that is a resource, Jeron, and I would challenge anybody listening to this that this is work that definitely needs to be spread and done. And obviously with the shooting at the Chiefs parade that obviously hit national news and that side, and hearing that you guys are able to step in and serve. And I know you said you don't necessarily do surgeries, which kind of just bring me to another one. Like, how do you partner with some of the other healthcare centers around here? Obviously, some of the individuals that you're encounter may need additional help. So how do you guys partner with the other healthcare centers around here to make that seamless?
Absolutely. I mean, the healthcare is such a large tent. It's 18% of the GDP in America. It's such a large tent.
Yeah.
There's only so much that we can do, and we think we do it at a high level. So we partner with Truman, we partner with Advent, we partner with KU, we partner with both Kansas City, almost every major hospital system in the Kansas City area. We partner with to make sure that we're referring patients there for specialty care and other care that we don't provide. And hopefully they're doing the same for us. They certainly send folks our way who really just need primary care. They need a relationship with a provider. These are folks that may not have been in any type of care in a long period of time. Want to get them to continue and want to get them the relationship with the provider that they need. So they do that same referral back to us. So it's a connected network of health systems, and we need each other, whether we like it, or we know it or not, or like it or not, and we all work together.
I appreciate you expanding on that. I mean, it just really, it does warm my heart to know that, organizations like that right here in Kansas City are truly not only helping those that maybe need that additional help, but even partnering with other organizations that can truly help and serve them short-term, long-term, all of that. Because if I've learned anything by being married to a healthcare worker like that, that regular physician that you can just go to and recognize and be comfortable around can really make an impact on your long-term health. So definitely appreciate that side of things. Let's stop talking about the business side of things, and let's start talking about you. You said you're not a medical expert by any means, and you're now running a community health center. But I know that every single day we don't have 100% of ourselves to give, but how do you go about motivating yourself to show up, serve not only the team members that you have that you're blessed to serve, but the clients you get to interact with and serve? How do you continue to stay motivated when maybe sometimes you just don't have 100% of yourself to give?
Yeah, I'll be honest with you. I think I am fortunate that I am passionate about this particular work, and that drives me every day. I am not someone who had the fortune of growing up without seeing mental illness and without seeing those who always had access to care, and without seeing how mistreatment in the healthcare environment can lead to long-term challenges for people's health.
Mm,
I've seen a number of instances where bad care, uninformed care, dismissive care can really limit people's lives. And I wanted to make sure that I changed that. And so,
mm,
although I'm not a medical professional, I have a heart and a passion for healthcare and believe it's a fundamental right. That's why I'm in
amen.
this work that I am in now. And so, there are certainly days where I am tired, where I don't have everything, but I try to bring my best. And certainly, the employees that work here give me all the life that there is. We had an event last night at the Lowe's Hotel. We do an annual fundraiser to talk a little bit about Swope Health, very similar to the conversation that we're having tonight. And one of the gentlemen who works for this organization, young guy, he pulled me to the side and said, "Hey man, I just want to tell you that I love what you're doing. I love what we're doing. Well, I'm proud to be at Swope Health. I'm
Mm.
proud that we're in the community, and I just want to tell you keep doing what you're doing." Those conversations are
Oh
often
yeah,
far and few between because people tend to be, sometimes folks who work for you are intimidated to come talk to you depending on how far you are from how big the organization is.
sure.
But also everybody's doing hard work and they're busy. So I just really appreciate that because that's the stuff that keeps me going.
I mean, what validation, Justin? I'm sure, like, I mean, every individual that I've spoken to, whether early in their career or running large organizations, that self doubt can sometimes creep in at anywhere. And having somebody that is on your team and just validating the vision that you have, I know it's lifted me up in days where I'm like, this is it. I'm done. I'm turning the keys in.
Yeah.
There are some of those
Yeah.
days. So, yeah. Well, I mean, Jeron, I would just like I'm recognizing from this side, like you are an approachable individual,
Thank
which
you.
is a unique leadership quality that you don't always see everywhere. So kudos to you for creating an environment that is that way with that kind of open door policy approach. Now, um, I want to kind of go back to obviously this big event that you had just yesterday. Is that right?
Yeah. Yeah.
Dude, we should have had this last week so we could have
All
gotten
right.
more people over there for you. But what are some other events that we should be, as a community here in Kansas City, be aware of? And maybe not necessarily you don't know dates right away. We can get that out at another time. But what are some big events that are incredibly helpful for you and your team that we can expose here and then give additional information when the time comes?
Absolutely. Well, there's a few. So we do this annual Lowe's event every year called this Swope Health Community Celebration. It happens every year around this time, around end of September. We also have a kids fair or kind of kids clinic, back to school fair. I'm sorry, every
Yeah.
year. One in Wyandotte County, one here at Swope Health Central, which is on MLK.
Okay.
Those events. We're still doing the Social Drivers of Health series around kind of helpful and big topics around how to keep people healthy, things that are really affecting healthcare in Kansas City. So follow us on LinkedIn and Facebook for those dates. Next year we'll have a women in healthcare celebration luncheon. So we're celebrating folks like your wife, women who
All
are
right.
leading in healthcare, and would love to invite you both to attend that.
I appreciate that.
So the dates and times and locations for that are still being worked out, but I'll make sure to get that to you. So I would just ask everybody to follow us on all the socials, Swope Health, easy and simple, and you can find much more about the work that we do and all the events that we have.
Awesome. I'll make sure to throw that in the comments on this LinkedIn live post, and that'll stay there until those times come. And then we can definitely keep you posted on that and get more info that we can get out at a more timely spot on that side of things. Well, Jeron, I know we're kind of reaching the end here. If anybody that has tuned in maybe is interested in learning more about Swope Community Health, resonates with a lot of what you are talking about, what's one of the best ways for them to get a hold of you to either learn more or maybe want to be a part of the vision that you're casting? What's the best way for them to get a hold of you?
Which I try to be a very accessible leader. Most of the town halls and public meetings that we have, I give my cell phone number out because we're a community health center, and at the end of the day, we're for the community. And if I can't be in front of the community and be accountable to the community, I shouldn't have this job. So here's the easiest way to get me: 816-729-4731. 816-729-4731. Jeron Ravin. That's the easiest way to reach me. There's also my email, jlravin@swopehealth.org. That's JLRAVIN@swopehealth.org. And also follow us on all socials, Swope Health on LinkedIn, Facebook, and Instagram.
I'll definitely throw those in the comments on this as well, just so they can have easy access to that. I want to say thank you for coming on this show. And also I want to give a shout out to Montoya for helping coordinate all of this too. She has been fantastic to help get you ready for this show. And I really do appreciate that. And part of my wife and I's gratitude for you spending the time with us on More Than a Business Live, we want to make sure that we're able to show that through one of our meals that we can send to a team member of yours or anybody else maybe that you see might be in need. So if you have anybody in mind, maybe tell us a little bit about that person or reason why you might want to send that individual gift to them.
Yeah, I definitely do. So we have an outreach clinic, and that outreach clinic really is built for, caters to, and is all about those that are unhoused in Kansas City. And so we have a clinic here at Central. We have showers and other amenities, kitchens and other amenities for that population. I'd like to dedicate the meal that you mentioned, Mitch, to any one of those number of folks who are coming here to get care. And thank you for giving me the ability to pass that on. That means a lot. And I really do appreciate it. I know they'll benefit from it.
That's awesome. Yeah, I guess I do get to be a little selfish with the idea that we get to play a small part in the impact that you and your group have on the homeless community here. So yeah, I am grateful to be a part of that and be able to help in a small factor of that. And we'll make sure to connect offline here to make sure we get everything we need to make sure that gets delivered on time there. Man, I know that we're pretty much out of time here, and I just again want to thank you from the bottom of my heart in all of this. Anybody that is tuning in, we're coming live to you guys every single Thursday at 3 p.m. Central Time. We'll be back with another great guest next week, talking about, again, what truly makes these organizations more than a business. So if you've ever been interested in joining the show and you run an organization that any of this kind of resonates with you, I'd love to have a conversation to have you on this show. Jeron, if you have any last comments, advice, wisdom you want to give to our audience, otherwise I'll go ahead and kick us out with the outro.
No, Mr. I want to thank you for the opportunity. I love this idea. I love what you're doing, giving nonprofits and other folks the opportunity to talk about what they do. We appreciate the spotlight. We don't always get it. So thank you for the opportunity.
Thank you, Jeron, for all the work that you guys are doing at the Swope community as well. Thank you again to Clarity Direct for being a sponsor on this show. And until next time, have a wonderful week, and we'll see you next Thursday.